Hello, everyone. Welcome to the Digital Health News and CHIME India Annual Survey 2024 on the state of cybersecurity in healthcare. My name is Vishnu Saxena. I'm a founder and CEO of Digital Health News and ScaleHealthTech. I'm very honored to have Mr. Girish Kulkarni, the CHIME India chairman, and the seasoned CIO and the CISO with me. I can't have any better person with me, shedding light on the state of the cybersecurity in healthcare in India. So one of the things that before we get into the nitty gritty and the insights that we uncovered for the cybersecurity survey, I'm going to highlight a few aspects of why we did this and what was the methodology and the demography and all those things. And this is a part of our initiative in Digital Health News, where we're trying to understand the pulse of India's healthcare. So early on in January, we did our survey on the state of digital health trends and outlook in 2024, and we unveiled those results in DHN Forum Bangalore. In DHN Forum Mumbai, immediately before, we did the survey in May. We surveyed around 100 hospitals across India and across a variety of hospitals, large, medium, small hospitals, and we focused on the key decision makers such as CIOs, CDOs, a VP IT, General Manager IT, Director of Infrastructure and all. And we wanted to understand what exactly the challenges, what are the challenges that they face when it comes to, the cybersecurity. India as a nation ranks top 6 globally as a vulnerable country when it comes to, the number of cyber attacks globally, right? And India is also, going through a major transformation when it comes to digital adoption in healthcare. And with that, the intensity and the likelihood of, attacks on the healthcare institution goes up. So we wanted to understand really what are those challenges, what organizations are trying to, do in order to remediate those, challenges. And also, in terms of, where they are going, what kind of preparation they're doing in order to protect themselves. So before so this is where Girish the context and the premises was, and we uncovered very interesting facts, right? In terms of like what are the opportunities in cybersecurity in healthcare, what are the challenges in healthcare. Before we get into the real insights, what is your overall take, GK, in terms of where you think as a CISO yourself, as a CIO yourself, as a CHIME India chairman who works across a variety of hospitals, stakeholders, what's your synopsis?
Well, thank you, Vishnu. Thank you, DHN. And it's going to be my pleasure, my privilege, and an honor to be a part of this podcast with you, Vishnu. But before we begin, quick reality check. It's no more Mr. Girish Kulkarni, it's Dr. Girish Kulkarni.
All right. Congratulations.
Thank you. A lot of hard work, blood and sweat has gone into it, so I should possibly capitalize on it.
Absolutely.
Yeah. Having said this, and becoming a little serious, and so is the situation out here in the marketplace today. Cybersecurity is of let's say what should I say? It's a topic which is today being discussed not just at the IT levels, not just at the hospital operations level, but right at the board level.
Yeah,
we're not talking just about infosec, cybersec, or datasec. It's security in totality.
Correct.
What is being discussed with the advent of digital, a lot of emphasis and focus on going digital. What has happened is the amount or the volume of data which is being churned out has grown humongous.
Correct.
Right? And these are very, very sensitive data. We come from the business of providing health and healthcare to our customers, which is a wrong word, to our patients.
Right.
When we are handling this kind of a data, as a custodian of this data, it becomes extremely, extremely important for an organization or a provider or a hospital per se,
Right.
to be extremely sensitive to the way in which I'm going to handle and manage this data. And I'm
Right.
going to manage this data over a period of time. It's not that I'm doing it now, 30 days down the line, I'm going to discard this and say, hey, look, I'm going to create fresh data. No.
Right.
I've got to run this for years after years.
Correct.
Right? So that is the challenge. Now, why is it a challenge? It's because everybody from the other side of the line want to lay their hands on this data.
Okay. Yep.
Very precious.
Yeah.
Probably more precious than oil today.
Yeah. Data is the new oil. Yeah.
Data is the new oil, and
Yeah.
healthcare data is probably the high octane fuel which everybody wants.
The V power.
The V power.
All right.
Right? So, yes, more the data, more the ingress and egress points for this data, the more complex it becomes to handle and secure this data.
Yeah. And I think you made a very important point. As the digital intensity increases in healthcare in India, and the custodian of the data, the data where it belongs to, and the kind of the people who are responsible to safeguard the data. In many organizations, the CISO, as the leader who takes care of the information security ecosystem are there. But there are many hospitals, GK, across, in tier 2 cities and tier 3 cities, in the hospitals where those leaders are not there. Do you think, so I'm just slightly deviating. We'll talk about our opportunities and the challenges, but I just want to have your quick take in terms of, the larger health system, larger hospitals in India, they have a dedicated CISO, there's a dedicated team, but still they are vulnerable. What is the situation in tier 2, tier 3 cities, and how they are safeguarding the patient data? Because patient data is patient data, that's available for large hospital and small hospital as well.
Very good. Now, this is something which is very true, and it's universal. One size doesn't fit all.
Right.
Right. In India today, even when you look at A, B, or C category of cities,
Right.
you have providers who are, let's say, up to 50 beds, 50 to 100 beds, 100 to 250 beds, 250 to 500, 500 to 1,000, 1,000 plus.
Right.
These are categories, and this is spread all across A, B, and C category cities.
Right.
The amount of investment, when I say investment in terms of technologies, investment in terms of human,
Capability. Yep.
capital and capability into safeguarding this could vary, but then fundamentally, it's all that every hospital is doing it. However, it is that what gets reported most of the times is what happens with the ones who are bigger brands and who have bigger visibility.
Yeah.
And to a lot of extent, the smaller ones, even if they have been compromised, would not come out and speak about it. And typically, I know a few instances where it just gets pushed under the carpet.
Okay.
Right? So there is no real way where you can enforce and make sure that every single health provider generating even a single byte of data, this is the way it needs to be compartmentalized, containerized, and then managed from a security perspective. There's no single.
Real quick take as a follow-up question. Do you think, as you rightly said, the smaller hospital or even the hospital in the tier 2 cities, they're not even reporting. They might have affected with some data breach or something. Should there be a national policy or some framework that essentially guides or mandates them in a manner that something happens so they're accountable to it?
Exactly, and that's what has been envisaged, and I think there are a lot of institutional bodies who are working towards this, and hopefully the way we came out with a very strong data privacy and protection bill, we should also have a very strong law which speaks of how to handle, manage, curate to everything.
Right.
How do you handle and make sure your data and your information is secure?
Right. Yeah, I think I look forward to such policies rolled out across India, and so that it is more equitable and, applicable to all the healthcare institutions. Now let's get into a little bit on the survey results. So let me start, GK, in terms of the gaps in the healthcare cybersecurity, right? So one of the very interesting fact that we uncovered, through the survey is that, there's a widespread absence of dedicated cybersecurity teams.
True.
In the larger organizations, there are CISO, but there is a widespread absence. And I think one of the key things that you can prevent is to have, the guard who's going to safeguard the patient data. If there's no guard, if there's no stakeholder, if there's no leader, it becomes very challenging. What's your take on it?
I definitely agree on this, and I'm sure looking at the survey results, this has come out very evidently from the responses. How much did we actually survey? We got about
we did
100 plus
responses,
right?
The key leaders across a variety of hospitals across India, North, East, West, South. And these are all the CIOs, CDOs, VP of IT, VP of Infrastructure, GM of IT. So the sample size are really good.
Right. So if you really look at what are the outcomes here, and then it's very evident that end of the day, hospitals still do not see, when I say hospitals, let's leave out those top 10 individual or group of or network of hospitals. They have all the wherewithal, hopefully.
Right.
But when you look at people below that, I think the biggest challenge is the IT head or the CIO is expected to double as the CDO and also triple as the CISO, and probably even be asked to play the role of a data privacy and a data protection officer.
Okay.
Right? It becomes somebody who is a jack of all trades but a king of none. And in this situation where the particular leader himself is not completely equipped to handle these kind of situation, it's going to be very difficult for organization. Now, which came first?
Right.
The CISO came first, or the threat and the attack?
Yeah.
Right? So half the time it has always been, though hospitals in India today talk of being more proactive than being reactive in care, but when it comes to investments in and around security, they have always been reactive. Majority of it, majorly.
So at the board level, at the top level, I think there is still not as a sense of urgency in terms of investing into the right type of human capital on the cybersecurity side. Whether it's large or whether it's small. So that's where, I think the needle has to move at the top, at the board level.
Yes.
And they should understand the importance of cybersecurity because they're in the business of healthcare. The patient data is the most critical asset that they have.
But sometimes, Vishnu, unless it comes top down.
The CIO has anything, they can't do it.
Can't do much.
Thanks, GK. So the other fact that in terms of the gap that we covered, that many organizations do not perform regular risk assessment, and that essentially leaves them as a vulnerable to emerging threats. So one of the key thing, in terms of an organization can make themselves more robust is to periodically do information security risk management and assessment. And the survey identified that it is not happening. What's your take, GK? Why they are not doing more proactive risk assessment? And maybe it is happening in the pockets, but not across. What could be some factors? What's your take?
Well, there are very many reasons, but then ultimately this boils down to the socio-economic factors here. Let's say if I have to do an audit and an assessment every quarter, every half year, it's going to cost me money.
Okay.
One, I don't have a team of my own.
Okay.
By the size of my operation. Two, if I have to bring a team, then I have to hire resources who come in as consultants and then do it, and they charge a bump, right? So is it really worth doing it? Right? Again, comes back to the chicken and the egg story,
Yeah.
right? So it's predominantly
It's a cost issue.
TCO ROI kind of an issue.
Okay.
What's my cost of doing this over the next 3 years? What's the return on investment I'm going to have if I do this?
Help me understand. I want to double click on this a little bit. Either the board and the hospital CEOs, I mean, the large ones, they do understand. They have the CISO and the teams and they do it. But, the many other hospitals, do you think they don't take cybersecurity as a serious area? They're running the hospital, but they are not taking cybersecurity or, like a stepmotherly treatment or, this is something not very important for them. The CIO, I mean, they will invest in infrastructure a little bit. But I think when it comes to information security investment, they're not serious about it. Is that the culture thing? Is it like the culture thing or?
Yes, it's the culture. But then again, look at the survey outcome here, Vishnu, and I want to read it out for the benefit of the audience here. Budget constraints, rapidly evolving cyber threats, and the complexity of healthcare IT systems further exacerbate these vulnerabilities, highlighting the urgent need for improved resource allocation and continuous risk assessment.
Yeah.
Now, this is come out very clearly.
Correct.
Now, this is what the IT leaders of, let's say, about 100 different healthcare providers in India have expressed explicitly, saying that, boss, I have a constraint. I have constraint on manpower, I have constraint on my budgets. While threats are increasing, I acknowledge that threats are becoming complex, my systems are becoming complex. However, resource allocation is still a suspect.
Yeah.
Right. So it again comes back to it. So what is happening here is, end of the day, if today the provider only looks at it from his P&L perspective, his EBITDA perspective, it's going to be difficult.
Okay.
It is going to be difficult.
I will check. I will actually switch to opportunities in healthcare real quick. But before I do that, do you think GK a regulation in the US like HIPAA, and in the US it's very strong. Of course, US hospitals are still vulnerable. You might have heard about the United Healthcare, fiasco and Change Healthcare fiasco and all. In spite of all those things, I think the infrastructure and the sincerity and the commitment is really high. My question is, in terms of investing into the cybersecurity, is something that, the framework, basically the regulatory framework. Do you envision a framework is needed? It's high time India should have its own HIPAA version. It could be anything, but should be contextualized for it.
Yeah, as I said, Vishnu, at the beginning of the conversation, there is a definitive direction in which we are walking to.
Okay.
And it is a possibility in the next 1 to 2 years.
Okay.
We will see some framework.
Okay.
Which is executable, which is as per the law of the land.
Okay.
And probably it's going to be that we're going to learn from where HIPAA had its shortcomings, or where something else
HIPAA has a shortcoming. Yeah.
Yeah. Everybody knows. So how effectively we bridge that and make it meaningful for use. Now I'm using certain terms from the US terminology. So how are we going to make it meaningful to use?
Yeah.
And how are we going to implement it here in the marketplace?
Right.
Is what is going to be critical. And I think we are in the right direction. There are a lot of people, a lot of bodies who are working for it. And I'm sure we're going to have something very, very strong, very rigid and robust in probably anywhere around 18 to 24 months.
Excellent.
Which is implementable.
That's very encouraging, and I look forward to our 2026 State of Cybersecurity in Healthcare and talk about the new framework that India enrolled.
Absolutely.
So look forward to that scenario. So let's switch gears, GK, and for our audience. In terms of opportunities in healthcare and cybersecurity, this is something that, what the silver linings are, right? So just for our audience, there are a couple of opportunities that we, identified and we uncovered. Like there's a greater opportunity for enhancements. Investing in dedicated cybersecurity team, improving anti-phishing and anti-ransomware measures, conducting regular risk assessment as we just spoke, training programs for the staff. This is as basic as could be. training program for the staff and leveraging third-party expertise, collaboration with external partners for information sharing, greatly enhance overall resilience, protecting sensitive patient data and critical IT infrastructure. Now, Jiggy, I wanted to have your take on it in terms of, even if the CISO is not there and the CIO is wearing multiple hats on the cybersecurity side, they are equipped in terms of procuring some right software, investing into team, and training in the staff, because majority of the cyber attacks are like phishing. Like whether it's a healthcare organization or a non-healthcare organization, you just click it, it's so real. So do you think that kind of training programs, which are not very expensive, which can be a regular, like a quarterly initiative led by a CIO, approved by the board, do you think that can potentially move the needle in awareness across the enterprise?
Yes, and to a certain extent, no. I'm being skeptical about it.
Okay.
Yes, it is very important that we look at prevention, and the best way to prevent this is to have an informed workforce.
Okay.
Right? Which came first, the chicken or the egg? So it's going to be a constant battle out there.
Okay.
One set of people trying to go on top of the other, and that's where it's all about, and that's how the war is happening out there today in the marketplace.
Correct.
Right? Having said this, if I have a informed workforce, I'm saying half my battle is won.
Correct.
Half.
Totally agree.
I'm not saying complete, half. Okay. Now, one of the things which has come out very, very clearly here in the survey, almost 68% of the people said that they have been vulnerable to phishing attacks.
Correct. Yep.
Now, most of the organization use a O365 kind of a platform, or a Google Workspace, or a Google Suite kind of a platform. Now, how many times a CIO or an IT head, for that matter, let me not get the CISO specifically, because that's still something which is still happening in the marketplace here. So how many times have you used those inbuilt anti-phishing things, those utilities which are built in to these systems by default anyways?
Yeah.
How many times did you use it to run your mock? How many times did you run it on your own set of people and tell people, hey, look, you guys failed. And this is how it needs to be handled, and you got to become better, and you got to become more informed, and this is my job to come and tell you what to do and what not to do. I don't think even large organizations would have even done this.
Right.
So, see, while there is going to be a crunch on the investments for sure. And when I say investment, it's not just about the money which is going in, but even on the resources, because this is also costs money, right?
Right.
So investments are always going to be an issue. But as an IT head, as an IT leader, how are you going to use these small things to make sure that you're trying to build that protective layer around by enabling your people to think better and to act better? That becomes very, very critical. And I think training and empowering your own people doesn't cost too much of a money.
Exactly. That's what I was thinking. In fact, I go back to a philosophy of the culture transformation, right? People, process, technology. Many of the things, can be done very easily with will and without breaking the vault, right? Doing a workshop, doing a kind of like a webinar, or doing conducting a kind of like workshop. As you said, awareness campaigns, mock drills, once in a quarter, once in a month, whether you are a CIO or whether you have a CISO, whether it's a dedicated CISO. So I think it has to be a part of culture.
Yes.
Like a kind of like a schedule.
Yes.
And I think if it happens, you'll see the outcome.
So this is where I think the change is going to come in.
Right.
Quick example, here at NIMHANS, we do this Cyber Jagrata Divas.
Wonderful name.
Once in a month.
That's an excellent name. Cyber Jagrata
Divas. It's a particular day.
Yeah, particular day.
And this is something which has come as a directive, not by the institute management, but it comes as a directive from MOH and FW.
Excellent. Okay.
So we do this. We invite people. Sometimes we invite specific teams, specific roles, specific departments, and then we have a focused session for about 1.5 to 2 hours, talking to them on what are the challenges and how are we looking at their support to mitigate it. So we've been consciously doing this now for about 1.5 years.
Okay.
Right? So these are things which should come in as a culture to the organization. But sometimes what happens is either the workforce is too small or the workforce is too large to run these kind of campaigns and sustain it over a period of time. It's got to be a continuous process. Ek baar maine kar liya, and then after that for the next 3 years I don't even talk about it is
Not going to help.
Right?
Yeah.
It's not going to help.
Yeah, good
right?
point.
So while having spoken about phishing, but then look at it, almost 50% have said that they have been prone to ransomware, and third-party risks is even bigger than ransomware.
Yeah.
Right? So the message here for me is, well, we're working in an integrated ecosystem.
Correct.
But while you're bringing your ecosystem partners on board, please make sure that each one of them is compliant to your own systems and processes.
Security policies and governance and all.
Exactly.
And I think you made a extremely important points, because in healthcare, the penetration in the point solution or the point solution penetration in the ecosystem of healthcare IT is going to increase tremendously, right? Variety of point solution, variety of tools and technologies, and I think it is important for CIO office or the CISO office to lay out very clearly the IT strategy and IT, information security governance strategy, right? In terms of how it will be governed, how the information security is governed across the enterprise, and the vendor has to, whatever they need to first comply there, and because these are all entry points.
Exactly.
These are all entry points. The complex the digital integration ecosystem is, the more vulnerable organization is. Right? These are all entry points. Good point. So let's move into the next. I think we partially covered cybersecurity leadership and teams. Close to 50% respondent replied that no dedicated teams, and so this is alarming. And to your point, GK, that you were mentioning earlier, I think it is proportionate to from the top leadership and investment point of view.
Correct. But then, Vishnu, I am not looking at this specific slide in isolation, but then I'm looking at it along with another slide, which is an outcome of the survey, which speaks of current state of cybersecurity.
Yeah.
Okay. Now, this is where my concern is. On one side here, 22% people said they have dedicated teams and they've been doing good.
Yeah.
On the other side, majority of the people are saying that, look, my cyber security posture is good. That's something which is
contradictory.
I see a disconnect there. So I'm not saying the survey is wrong.
Yeah.
I'm not saying the outcome of the survey is wrong.
Yeah.
What I'm saying is, look, as an IT leader, please introspect.
Correct.
If today large organizations can come back and say, I have done so much, I continue to keep doing so much, which is as per what is defined, as per the best practices, blah, 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 and still, and this is a very interesting thing, the large set of providers, the largest set of providers, which I said the top 10, if you look at their response, they are saying less than 5%, right?
Yeah.
Now, if people with so much of investments say that I'm less than 5% hard in terms of my security deployment, and the balance people which are below those top 10, where again you get into the issues of investment and availability and technology and demographics, a lot of issues.
Okay.
They're still saying that 57% are saying that it is good.
Yeah.
That is not correct.
That's not correct.
And that is where I think these 57% of the people have to go back to the drawing board, introspect, and then say, how did I actually say that my security posture is good, and how now do I make it better?
Right.
More than happy to talk to the respondents if they have any questions.
Yeah, I think we should do some follow-up, particularly, these two questions.
Correct.
Cybersecurity leadership and teams, and their overall response that, we are good.
I can't be saying that on one side I have all the problems in the world, but on the other side my cybersecurity posture is good.
Yeah.
That is a disconnect.
Now, talking about key challenges in cybersecurity, when we ask this question, I think let's talk about GK on the key challenges that they face. So 69% says limited budget and resources. 70%, little plus 70% say that rapidly evolving threats. And 61.80%, they said that, complexity of IT systems.
Absolutely. Now, this is what is the finding.
Yeah.
Now, Vishnu, to all the people who have responded to this survey, and here is my message to them.
Right.
I've been here for over 20 years.
Right.
Small, medium, large, as an employee, as a consultant, done various things. There has not even been a single situation where I have said, look, I have all the available budget in the world to do the best of IT.
Yeah.
Never. So it is a problem.
Correct.
It is an accepted situation. It's a problem which we'll have to live with. I'm saying, don't keep talking about it.
Yeah.
It is going to be there 20 years down the line also.
Correct.
Because IT in a hospital is still a cost center and not a profit center.
True.
Until the time you are looked as a cost center, you will always be subject to this problem, which is you don't have investments.
Yeah.
Right? Yeah. So that's a problem we'll have to live with. Now live that, circumvent it, and see what are your other challenges. Now when you look at it, the other challenge which has come out explicitly, 71% says rapidly evolving threats. And almost 2/3 of the people say complexity of the IT systems. Now, I cannot control the threat evolution. Right? And it's not even an evolution out there, it's a revolution.
Correct.
Because every day, every minute, the threat posture's changing.
Yeah.
And
the bad
changing. Yeah. And that's the bad news.
Smarter. Yeah.
Yeah. Now, this I have no control. I have a control on the complexity of my IT systems. So as an IT leader, how do I simplify my IT systems deployment?
Right.
Right?
Yeah.
Just because the neighboring hospital is doing patient app. I'm also doing patient app.
Correct.
That guy has 2,000 patients being seen every day. You have 25 patients being seen every day, but then I want to do it. Right? No, that's not the way it is. Keep it simple. Keep it simple, because the more simpler it is, the better the control you have as an IT leader. The more the complex becomes difficult to manage, and your dependency on various skill sets and resource is going to be increasing by the day, and that is a threat. So keep your IT systems simple, manageable, and addressable, so that you are able to beat this challenge. I'm not speaking of anything else, but I'm specifically looking at what people said is a challenge for them.
Yeah.
And then this is from my experience. I would say keep it as simple as possible. Don't complicate it just because somebody else did it or you want to do it.
There are lots of data, right? And the hospitals are sitting on the data, like data explosion on a patient data side, and a variety of the data. The complexity of the IT system, do you think it can help if you go to the cloud? It can help, or if you continue to be on-prem? What's your intake versus like complexity of IT system goes up or goes down? What's your take on it?
Well, I don't think this is going to be a debate about cloud and on-prem.
Okay.
Honestly.
Okay.
Wherever you are, you still have to go through the same kind of threats.
Okay.
One. Cloud and on-prem is a very different debate. And my personal experience, I want to keep it very short and simple, is if you're setting up a server farm to run your applications, up to about 250 beds of in a hospital, or the size of about 250 to 300 beds, your TCO on the cloud is going to be higher than doing it on-prem.
Yeah, understood. Good point. Let's talk about strategies for compliance and training. So respondent replied that, regular audits, something pretty good. Engaging third-party experts is also a preferred means. Internal communication for awareness is the most preferred way in terms of compliance and training. So this is very aligned to what we just discussed, that, the hospitals who have budgets, they are engaging external partners, or they're doing internal. And internal communication for awareness is something that everybody can do. So that's the top strategies for compliance and training. Now, moving to the second last question.
I want to speak about it for a minute, Vishnu, here.
Okay, which one?
Just about on the strategies for compliance and training. And this is my experience. I was in an event in Calcutta, and this is about little around 2.5 years back.
Okay.
And on the stage with me was the additional Director General of Police, West Bengal Crime Record Bureau, and there's another gentleman I don't remember.
Okay.
Now, internal communication for awareness, and this is something which I did speak.
Okay.
I want to talk about it because on the stage during the conversation, he pulled out 2 small booklets, maybe of the size of your scribble sheet. Okay. 2 small booklets, about 6-8 page booklet. One booklet for school children up to class 7. And the other booklet for school children from 8th to 12th class.
Okay.
So they had made some changes. It's all about cartoons, and it's all about animation in there, in color, in local language, which said very clearly do's and don'ts.
Okay.
Right?
Yeah.
They went to each and every school, irrespective of the size, color, caste, creed, economic status, financial status, I don't know. They went to each and every school and made sure that each and every kid reads that.
Okay.
Now, it definitely not lead to 100% of the kids being enlightened. But if they had enlightened even 10% of the total population, that's a huge victory in terms of achieving the objective. So, again, I reiterate, internal communication, training is the key.
GK, I want to follow up on that. Do you think a simple measures such as, putting in hallway some posters, in cafeterias, some, having a leaflet or standee or, wall posters or something, and as you rightly mentioned in NIMHANS, that cybersecurity Jagrata Divas, so they can have a week or maybe like 2-3 days. So the awareness, when you see something constantly, you try to imbibe that. It reminds you constantly, right? So hospital hallways, cafeteria, reception, all those things. A simple posters. Do you think that can essentially help?
Posters, awareness in any form is welcome. We also do very, very little things.
Some videos.
We don't do that also. We just make sure that the screensaver, which runs when your Windows PC starts to sleep, every day it is changed. And every day it's a new wallpaper or screensaver which goes, pushed by the group policy. And then every day it talks of one thing. Did you log out before you left your station?
Exactly.
Did you change the password? Blah, blah, blah.
Yeah.
Did you do this? Did you do that? You should not be doing this. These are simple messages. We've got 30 templates and we run one template a day every month. Right? And half or more than half the people here are not IT savvy in a hospital. And I'm not expecting everybody to be. We are not an IT factory or a software factory out there. So, so for them, it is not about the text where you're communicating. It's about the graphical representation, which is a visual representation for them, which
To
is
understand.
easy to absorb.
Correct.
We've been doing that.
Excellent. And this is something that anybody can do. It doesn't cost too much.
No, it doesn't cost anything. That's exactly what I was saying.
And like awareness and understanding, and brings the culture change. The mindset changes. Anyway, great. Thanks. Let's talk about, let's say some incident happened. Cyber attack happened to a hospital. How well they are equipped in terms of managing those incidents, response and vulnerability.
Very bad.
Yeah.
Very bad.
What's your take? Yeah.
Well,
The survey results. So formal incident response plan, less than 40%. Regular vulnerability assessment, it's like 51%. So I think they don't have as such plan in terms of if something happens, how they're going to navigate. Are they going to inform the patients? And what exactly is the action plan in case of cyber attack that happens?
purely going by the advisory issued by the government of India, we have to follow the certain guidelines for incident reporting.
Correct.
But believe me, not very many people even know that there was a certain set of guidelines for reporting an incident.
Oh my God.
They would only go and knock at certain's door only when they realize that they've been breached.
Okay.
They realize that they have been attacked. They realize that they have been held to ransom, So, incident response has been very poor. If the incident reporting itself is not happening in time, then there's hardly anything certain can do, because
Exactly.
every minute lost is
The patient data is compromised.
is where you're clearly going down on an opportunity to kill that problem and come out of it successfully, right?
Yeah.
So that is where the problem is. Though 38% people have said that they have a formal incident response plan available. Now, believe you me, if I go back and ask them, how many of you have a DR and a BCP in place? Well, this number could come down by half. It is alarming. I'm not saying that people are wrong, because most of the people are not tuned to think on these lines.
Yeah.
Most of the people are making sure that their IT lights on function is going good.
That's it. Yeah.
Right.
Yeah.
They're not able to think beyond what they are doing currently. That's where the problem is.
Yeah.
It's not that somebody doesn't want to do it or somebody doesn't know how to do it. Even if I knew, I don't know if I had the bandwidth to do all this myself.
Yeah.
It is a challenge. And I'm sure we've done this in the past with a lot of large organizations. CHIME India would be more than happy to engage with them on a very, very independent, not-for-profit basis and help them design and structure all this.
Responses, policies, and guidelines.
And it's not that what I'm giving is the Bible or the Gita or the Zendavasta. What I'm saying is, look, collectively, this has been our experience, and I'm sharing this with you. Now, it's up to you to take it or leave it.
Correct.
You asked me for help, I've come and helped you with this.
True.
Try doing it. So we are more than happy to do it, but then people have to come and then talk to us. Otherwise, I wouldn't know what they are facing as a challenge.
Totally agree. This brings to our last segment, GK, and for our audience in terms of future steps and recommendations. So I'm going to read what we came up with. So the first one is invest in dedicated cybersecurity teams and leadership, very well aligned to what we just discussed. Enhance anti-phishing and anti-ransomware measures. Conduct regular risk assessment and audits. Develop comprehensive training and awareness program, very easy to do. Address budget constraints and leverage third-party expertise. Of course, that's something to top down from the boardroom. Implement and test formal incident response plans, to your point just now we discussed. Foster collaboration and information sharing with the external partners. And I think, so this is something very important. And I think even if out of these 7, if somebody is doing like 3 or 4, I think they will be pretty better off.
I'm going to put it a little differently.
Okay, sure.
One, you don't have to follow the sequence. I'm sure everybody are going to get a copy of this report.
Yeah.
Okay. With details. We're only looking at it from a surface now. But yeah, this is not the sequence of what needs to be followed.
Correct.
1. 2, you don't have to do this big bang.
Correct.
Start small, list down the low-hanging stuff, what is immediately achievable on a short notice, and then take a 1 year, 1.5 year plan, and then start working towards achieving that plan. And it's a journey. It's not going to happen overnight.
Yeah, it is journey.
And I'm sure even if the larger organizations with the investment muscle also wanted to do this, if they have not done it for whatever reasons, and if they want to do it, they put the money on the table, it's not going to happen overnight any which ways. It's still going to be a journey.
Correct.
Right? So I'm only saying, look at it, understand where you are from the benchmarks, what's available in this survey.
Yeah.
And then prioritize your low-hanging stuff and start working towards it. Achieve over the next 1 year from where you are. If you have moved up by 70%, that's a huge achievement for every IT leader. It's a huge achievement.
Totally agree, GK. And with this, I think we concluded our podcast of the state of the cybersecurity in healthcare. And I would recommend each one of you to go to digitalhealthnews.com and have a look at the survey. It will be posted online there. You can download the survey result. And please discuss that in your organization, some of the measures that you can take locally, low-hanging fruit. The idea is that, we need to safeguard the patient health information. And I think we need to take this as a cultural and as sincerity as it could be. So, and GK, I would really like to thank you for being partner in this.
Thank you so much, Vishnu.
Important survey.
My pleasure.
And CHIME India, being part of this survey, collaboration. So really value that partnership.
Absolutely.
Looking forward to, our next survey. So thank you so much.
And to all my fellow colleagues and peers out there, gentlemen, ladies, this is not a document to scare anybody, but this is the reality where we are today, and this threat is real.
Yeah.
Okay. Please take this seriously with whatever limited resources you have, whatever constraints you have. Please embark on this journey immediately, because there's nothing like there is tomorrow here.
Yeah.
There is no tomorrow here.
So appreciate, GK, your time. Appreciate the CHIME India support in the survey.
Thanks,
and to all our audience, thanks for joining.
Yeah, and you can be rest assured that CHIME India would be along with you in all these endeavor, and we would want to work jointly in terms of enabling our community members to probably do a lot much better than what the state is today.
Yeah.
Thank you very much, DHN team. Thank you very much to my fellow colleagues in CHIME India, and thank you. Have a great evening.
Thank you. Take care. Bye-bye.